I think if you're anything like me, oh, I have Canadians in the audience. Now, your job for this session is to just sit there and feel superior, okay? You're going to get a little look into the US healthcare system and how confusing it is and how problematic it is. This is a sort of a visual representation of how many of us feel every day dealing with health insurance. Agreed? Yeah, so our goal today is not to become full experts. Our goal is not to know everything. Our goal is to take this and bring it into something a little bit more manageable. So we're not getting rid of all of the squiggles, but we are going to be able to sort of smile through the pain, hopefully, by the end of our time together. And I've got to keep an eye on time because we've started a bit late, so I'm going to be talking fast. So why does it matter that we actually know about this kind of stuff? Heterotaxy families, families with medically complex kids in general, face higher costs and more paperwork. If we don't know from our end what we're doing, we can end up with unnecessary costs. If we can understand the terms, the definitions, we will be more effective advocates for either ourselves, we have adult patients, or for our children. And understanding how your coverage works means that you as a family are going to be better able to access the care that your child needs, whether that's therapies, specialists, equipments, and you're going to be better at doing it without delays. We're late in the conference at this point. We're late in the day, so you are going to be sort of bribed to continue paying attention with memes occasionally. Okay, so sit with me. What do you mean? What do you mean? Okay, let's talk about it. What do we mean? There's a bunch of terms that you're going to hear when it comes to health insurance, and I'm probably preaching to the choir here for those of you who are in this room, but as we move forward and as we become advocates and we spread our own knowledge, we want to have a solid base so that we can then reach out to other families in the community and be able to answer these questions when they come up. We're the core crew here. We're the ones who have showed up. We're in person. We're going to be able to bring this knowledge back to our community, whether that's online or a phone call in the aisle of Target. Your premiums are what you pay monthly for coverage. Everyone pays healthcare premiums. Oh, sorry. We're going to talk about private insurance first, so employer-based insurance. With an employer-based plan, you're going to have premiums every month that you're going to pay. It's going to come out of your paycheck. It's either going to be once a month or every 2 weeks. It's typically every 2 weeks. Okay, so everyone's going to pay that no matter what with an employer-based plan. Then you're going to have, or not, we'll see, a deductible. A deductible is what you're going to pay every time you access services until the insurance kicks in. So even though you're paying premiums every month, they're not going to pay anything until you meet your deductible. This is an intentionally complicated system. It's a for-profit venture where they're trying to make money off of your child's illness. And it's not right, but we're going to do what we can to work within that system to get our kids what they need. There are co-pays and co-insurance. There's a lot of confusion surrounding these. Co-pays are fixed fees for services like lab draws, office visits. Co-insurance, so co-pays will be listed typically as a dollar amount. Co-insurance are typically, you'll see it listed as a percentage of a bill that you'll pay after you've met your deductible. Okay, so deductible is you're gonna be paying 100% usually until that's met. You meet that threshold and then you start paying either co-pays or co-insurance. Max out of pocket, I know we are all super familiar with it. We are folks who likely calculate our healthcare costs each year by just looking at the max out of pocket. We have it easy in that way that we can just sort of look at max out of pocket plus premiums. And we say, okay, that's what my plan's gonna cost in the year. Once you've reached your max out of pocket, theoretically, everything should be free. Sometimes you still have to fight about that. And then there's FSAs and HSAs. An FSA is also a flexible savings account. Typically, your employer owns this and will contribute to some amount to it, but it's use it or lose it. So you use it by the end of the year or before you move jobs, or else the employer keeps that money. An HSA is a pre-tax account that you contribute to. It's only available, typical with yet another acronym, an HDHP, we'll get there, a high deductible health plan. And those roll over, you can hang on to those and use those. Here's an example of one of maybe 7 or 8 pages of information that you'll get from your employer when they're telling you, here's your benefits, and you have to choose what plan you want. Everybody, stay calm. We're gonna figure it out. We're gonna go through it bit by bit, and we're gonna figure out what's best for our families. Okay? So, 4 main types of plans: HMO, EPO, PPO, HDHP. Okay, I should have been a cheerleader. We're just gonna we'll go down the columns, right? So an HMO is a health maintenance organization. Usually this is your lowest cost, but it's your most restrictive in terms of what you can access. You'll pay premiums, you'll pay copays, there'll be a deductible. You do not have, typically on an HMO plan, out-of-network coverage, which means if you go out of network, AKA you see a doctor that's not on their approved list, or a hospital or an institution or a DME provider that's not on their list, you're paying 100% no matter what. And you will typically need referrals if you want to see anyone other than a general practitioner. EPO, exclusive provider organization, makes it sound like a fancy club. Usually a bit of a lower cost, so it's your next step up from an HMO. You've got premiums, copays, or coinsurance. Again, let's go back 2 slides. Like it's a lot of information, right? No out-of-network coverage, but you can see a specialist without a referral. So we're moving up in the world here. Then we've got our PPOs. These are bougie, guys. This is preferred provider organization. It's a higher cost. This is a bit of a Cadillac here. You'll have premiums, you'll have copays and coinsurance, but you've got some out-of-network coverage. Typically the coinsurance, that percentage you're gonna pay is gonna be a bit higher in a PPO, but you will have those services covered. So if you're going, for example, out of state for care, you're gonna be able to access that without paying 100% of it. And then HDHPs, that's where the health savings account comes in. Super high deductible, but you match it with lower premiums. It's kind of a balance there. You're gonna pay a higher percentage out of network. You sometimes need a referral. Again, like the goal essentially is not to end up in a case where, for us, with all of this, what does this mean for us? Okay, we are families who need to get specialized care for our kids. And we wanna get the best specialized care for our kids. So we don't wanna just go to some guy. We wanna go to, for example, the best cardiac surgeon in the world. Don't let your garbage insurance plan get in the way of that, okay? In case you're not sort of up in the meme world, that's what that one means. So HMOs are for people on a tighter budget, fewer medical issues, and are just gonna be fine. Like this is the family up the street that you're a little jealous of because they see their GP once a year for a well visit, and that's about it. Maybe they go to the urgent care when they fall off the trampoline. So that's those guys. EPOs, you can be a little more flexible on price. You have a little bit more in the bank maybe, but you do need to go and see some more providers. A PPO, if you can afford some higher overall costs, and this is especially if you have very specific providers that you want to get to. This might be the plan for you. An HDHP, okay, so like now you're gambling. Now you're rolling the dice because we did that math before, right? We looked at our premiums plus our max out of pocket. An HDHP, you're going to have lower premiums, and you might have a little bit of a lower max out of pocket, or a higher max out of pocket, rather. But if you're not expecting to hit it every year, that's maybe not any of us, right? So do your research, figure out. Now, that's the employer side. There are other options. Who can tell me what these all have in common? Anyone? There it is. Renee's got it. They're all Medicaid. Are any of them named Medicaid? No. Okay, so the first thing to establish when we talk about Medicaid is that it's almost never called Medicaid. So you get pictures and then you have to look at a whole bunch of text. So it's a give and take here today, folks. Medicaid is a public health insurance providing coverage for both children and adults, either with limited income or on a disability basis with high medical needs. Medicaid is going to cover things that your primary insurance doesn't cover. Okay, you can use Medicaid as a secondary insurance. Did you know you're allowed to have more than one insurance? We all did. But there might be people out there who are new to the journey that don't know this, that have an employer-based plan and don't know that they can also, based on disability, even if by income they don't qualify, they may qualify based on disability for Medicaid. It's called something different in almost every state, which makes it very confusing. So really being intentional about looking, what is it called in my state? How do I access these services? And again, it's either based, there's not enough time in the world to talk about all this. It's either income-based, if you're below a certain level, or there are also waiver programs in states, and these will also vary super widely by state. They'll be named different things, and there'll be different eligibility requirements for different waivers. You can look up Medicaid waivers in my state. You can figure out what the requirements are, but you can have both private insurance and Medicaid. That's important to note, and you bill them both. Private insurance says no, Medicaid will often pick it up, things like seating, wheelchairs, feeding supplies, incontinence supplies. Medicaid is at risk in this country right now, and so I don't think it's fair for me to stand up here and not acknowledge that. We are in a tenuous spot in the country, so speak up, speak out, talk to your authority, your local government, talk to your state government, talk to your national government, tell them your Medicaid story. If you're on Medicaid, tell them why Medicaid is important to your family, and make them understand why this is important for us. We also have SSI, which is so it's a Social Security benefit based on the severity of disability. It may be sometimes it's harder to qualify for SSI, but if you can get in on SSI. In many states, you're automatically qualified also for Medicaid. So there are some states are weird about Medicaid, but if you can get on SSI, then you're good to go. Again, out-of-pocket medical costs, adaptive equipment. This is one that you can lose based on changes in income. So definitely go. So are we feeling good about it? We're understanding everything. This one's for my dad, but he is asleep, so he's missing the slide that I put in just for him. There he is. Okay, we're good. We're back. We're back. We don't want you to feel like this. We don't want you to look at your insurance plan and look at your explanation of benefits and to feel like this. We want it to make sense. And we want you to feel empowered to be an active advocate for your kid when it comes to health insurance. So how are we going to do that? Number one, get everything in writing. If you have a phone call with an insurance provider, ask them to email you about it later. If they say, oh, you're going to be denied, ask for written confirmation of that denial. Documentation will help to protect you. They want to make money. They don't care about your child. They will never care. There will be people who work in insurance who do care very deeply, but overall, at a systemic level, they don't care about your kid. And so it's going to be up to you to fight for them. Another great tip is to ask, you get a huge bill. I remember getting like a $240,000, that was actually not that big, bill, and thinking, why is this so big? Ask for an itemized bill. Call them back, ask, I would like to see an itemized bill. So rather than just the one line of you owe this much for services on this date, make them write down every single thing that they did and what they're charging you for it. 9 times out of 10, when that itemized bill comes, it will be less than the original bill that they sent you. Because once they've realized, oh, we can't charge them quite that much. Double check every bill against your explanation of benefits to make sure that what you're being billed is the same as what your insurance provider is claiming that you're supposed to pay. Don't take no for an answer. Definitely not on the first time. If you have a service or a hospital stay or anything like that that's denied, don't accept the first one. You can usually get them overturned. Ask for specific policy language. Ask them to quote your policy to you to justify why they are denying. One sort of backdoor thing that I often do is I ask for the name of the person who is making the medical decisions at this insurance company relating to my child. And that very frequently gets bills thrown out for me and gets denials overturned because they don't want to admit that they're practicing medicine. Say, what is the name of the person practicing medicine at United Healthcare, for example, who's making this decision about my child? They don't like that. You can request a peer-to-peer review. Then they should reach out to your child's doctor directly with their medical reviewer. This doesn't always work, but it's worth a try. At the end of the day, this is one of my favorite ones. Request a conference call. Okay, you can ask. Okay, how many of you have been told by insurance, well, you have to talk to your hospital billing about that. And then you call the billing department and they say, well, you need to talk to your insurance about that. Have we all done that sort of rodeo back and forth, round and round on the carousel? Ask for a conference call. Make all 3 of you on the same call together because they don't want to admit in front of each other that they're giving you the runaround and in front of you. And again, 9 times out of 10, I don't think I've ever had to escalate to that level and not gotten a bill thrown out. Detailed records, we talked about that already. Dates, times, names of people who you spoke to. First and last, if they'll give you their last, they don't always. And then you can keep an email record. You can email yourself records of these things, but keep a record of who you talked to and when. Then you can escalate to your state insurance commissioner's office, a Medicaid ombudsman. We talked about this. Nope, we're talking about this in another talk later. I've got my talks confused. They can often intervene. You can go to your state government. Sometimes they will get denials overturned for you. Know that there's a difference between internal appeals, which are you're asking the insurer directly, or an external review where you're asking them to call in an external service, and you are entitled to both. Your medical team should hopefully be an ally for you in this. They may need to provide a letter of medical necessity, clinical justifications, all of that. And now this is where it's really frustrating because we have to stay calm. We have to stick to the facts. Your emotions are valid, and I will say, and this is maybe off the record, well-placed tears sometimes get results, but I wouldn't start there. And I'll leave it at that. Come talk to me later. Now, I don't always consult experts on health insurance, but when I do, they are the appropriate ones. I chatted with, over in the clinical sessions, we had a woman who works in the cardiac system over at Boston Children's, and she works with the insurance billing and getting kids covered for out-of-state care. That's something that's super relevant to a lot of our kids in looking for care out of state. So what do we need to do to make that happen? I'll send you the slides, don't worry about it. Private insurance does make it easier to go out of state, but it's not essential. You'll have a harder time when it comes to Medicaid getting covered out of state unless they have a contract with other states, for example, New Jersey and Pennsylvania, they will accept some across state borders, but Utah to Boston might be a little bit trickier. Expect extra steps and start early getting those letters of medical necessity, because that is going to be your key to getting Medicaid covered out of state. Your local cardiologist and the surgeon or specialist, whatever, who you're trying to access. Well, I said cardiologist because this was on my mind, but because she works in the cardiology, but your local specialist and the specialist you're trying to access, they both need to say why it's important for you to go out of state and why you can't just stay with this guy. There's two different kinds of plans that you can get under Medicaid. A managed care plan where one of these bigger companies like Aetna or United Healthcare are actually going to be administering your Medicaid, or a fee-for-service, which is just kind of straight Medicaid. The managed care plans tend to be more flexible. So when you're signing up for Medicaid, if you may be given one of those sheets with all the different options, keep that in mind. If you're on a marketplace plan, if you're buying marketplace insurance, check for out-of-state benefits, because before you sign up for that plan, not all marketplace plans will provide those. And again, documentation and persistence. If there's one thing we know how to do, it's be persistent. At the end of the day, it's all about building your team. It's not doing this alone. Your knowledge, your understanding of what's going on is powerful. Understand your plan. It is boring, and it's frustrating, and it is confusing by design. But taking the time to write yourself notes, write yourself out a flow plan of what you expect to pay. Know this language, get to know it, and that will help you advocate confidently and clearly. Persistence pays off. There's a reason I keep saying this. I had a bill, just sort of anecdotally, but was it a whole year? Was it over a year, that bill? But I knew I didn't owe it. And they kept trying to get me to pay it for well over a year, and I didn't. And I didn't have to. And if you were paying attention, you will have heard all my tricks that I had to use for that one. They've been sprinkled throughout this talk. You can follow the breadcrumbs. But at the end of the day, you don't have to do it by yourself. This sort of thing can feel very isolating and very overwhelming, but don't try and do it alone. Lean on your care team, on other families and advocacy organizations like Heterotaxy Connection. Come into the support group. Say, hey, has anyone dealt with this? What have you done? What's worked for you? Who's from this state? Who can I connect with that's from my same state? Who's from the state that I want to access care in? And together, we're going to get this system to work better for all of us. I'm going to turn it back over to Carly.